Good morning, everybody, or good afternoon, or good evening, depending on where you're dialing in from. Welcome to today's webinar on investor expectations. My name is Stephen Gugu. Just before we kick into our webinar, I'll invite my colleague Phyllis to make a quick presentation about the R2C program. And then after that, we'll run straight into our webinar. I'm very, very excited. We have some really good speakers who I'm going to introduce once we get started with that bit. So Phyllis, I'm going to invite you to do a quick presentation on the R2C program, and then after that, we'll jump straight to the webinar.
Okay, allow me to share my screen. So good morning, everyone. Thank you for joining us. And I'm just going to give a brief of the R2C program. You know, most of us are part of the team from the R2C program itself, but generally this project itself is funded by the FCDO through the RISA Fund. And the essence of the program is to bring together researchers. This is now the actual motivation of the R2C program, is to ensure that the research that we have in our institutions, we have a lot of research in our university shelves, in databases and libraries, but they have a lot of potential. The potential to turn into services that would make an impact in society, others into programs that would change people's lives. So the motivation of the R2C program is to ensure that some of these researchers do not die at that point, that they are able to cross to that aspect of market to be able to make an impact into people's lives. So the R2C program is structured in two ways. One, the accelerator program. And at this moment, the accelerator program has 3 cohorts. 2 cohorts, the first and the second cohort in Kenya, and the third cohort in Ethiopia. The accelerator program mainly focuses on to get managements to buy in on the aspect of the commercialization research process. And the other thing is to strengthen researchers' capacity by taking them through the accelerator program. And the accelerator program, which I'll mention along the way, is structured in around 3 or 4 ways. One is that we have the training weeks where we take researchers through specific topics that they need to understand, key areas that they need to understand so that they can commercialize, such as understanding them, taking them through the business formation process, taking them through the licensing and commercialization strategies. Then the second aspect of the accelerator program is the coaching and mentorship aspect. The coaching and mentorship aspect involves connecting the participants to experts, industry experts of different fields, and linking them to have coaching interactions where they reach out to them about specific struggles that they are facing in their commercialization journeys. We have coaching in all the different aspects, GESI, business formation in itself, commercialization, grants application. So the essence of the accelerator program, just as I had mentioned, is just to strengthen their capacity. Then there's also the second aspect of this program, which is the training of trainers. We realize that through the program, researchers, very specific researchers, get to benefit from this knowledge that we share in this program, but there's little replication of these efforts in the institution. So what we did is that we came up with the training of trainers program. This program selects trainers from specific institutions all over the country to have them come in, take them through the R2C program in itself. And then we also support them as they take this program into their institutions and help them implement this and pass this knowledge to the institutions as well. So just as I had mentioned, the training, then there's the TOT training, the coaching and the mentorship aspect, and the webinar. Now this webinar is part of the other aspect of R2C, We usually arrange these webinars on a monthly basis. The essence of these webinars is just to create these spaces where we bring in experts in particular areas, like this one where we have the investors' expectations. It is a very key webinar that, as most of the researchers are moving on to a phase of engaging investors, just to understand what are investors thinking, what do we need to get ready so that we can say that we are investor ready. So that is why today we have Teresa and Simon, and our moderator, Stephen Gugu, who's part of the Victoria Ventures team. They will take us through this webinar, and I know it's going to be of very critical essence. So I think I want to invite Stephen Gugu to give an introduction of the webinar and also to introduce the two speakers that we have. Thank you for joining us.
Thank you very much, Phyllis. Really appreciate that introduction to the R2C program. So I'm going to invite both Simon and Teresa to put their videos on, and then we'll get started. Today it seems we have the 3 S's. No, actually Teresa is a T. I was guarding for 3 S's. Today's webinar is one that I think is very useful, because it goes to one of the key challenges that whenever you talk to innovators, one of the key things they'll tell you that they face as a challenge is the financing bit. In my view, financing is often a symptom, but is also, at times the key problem. But I find that it's often a symptom. And so today we're going to be unpacking, this financing question, with very able people who work with innovators. I like that we didn't just get, the panel to be just generic investors. These are people who work with innovators on a day-to-day basis. And so from that perspective, they're able to share with us their own insights directly in terms of what, innovators need to be thinking about from a financing perspective, how they approach things from that, when they're looking to work with innovators and so forth. And we're going to keep it very conversational. But first of all, let me allow my panelists to introduce themselves. So I'll start with Teresa. Teresa is from the Global Innovation Fund, but I'll allow her to just do a quick introduction about herself. And as she's talking about that, maybe also mention a few things about GIF and how they sort of like think about investing in innovators. And then after that, we'll move on to Simon. Teresa, over to you.
Thank you very much, Stefan, and thank you, Victoria Ventures, for organizing this webinar. So my name is Teresa Busibori. I call myself now an aspiring grant maker, but an economist by training, and my previous experiences having worked in a think tank, so in research specifically, a little bit in civil society, so also understanding, how do some of these solutions reach the targeted population before coming to now GIF, where I'm an investment associate, and do the whole process, sourcing innovations, diligence process, and then portfolio management. So a little bit about the Global Innovation Fund is that the Global Innovation Fund is a hybrid fund with the ability to make both risk capital, which is usually debt or equity instruments, and grant investments. And I specifically sit on the grant investment team, or what we usually call the public sector scaling pathway team, which I can explain a little bit more later on. And so 3 things about the GIF maybe is one, that is our mandate is to find and fund innovations with the potential to deliver what we call cost-effective outcomes at scale for people living below the $5 mark. So really keen on that target population of the people living in poverty. And when someone says innovation, we think, tech or startups only, but for us, innovation is defined very broadly. Anything which is not already widely practiced, could be a product, a service, a business model, a policy, really anything at all. And this makes our mandate really broad, because we also fund across all sectors, across all geographies. But because of that focus on the people living in poverty, we tend to have a particular interest in Sub-Saharan Africa, Asia, and Pacific. Second thing about GIF, and one of the reasons I was excited about this, is because we place rigorous evidence and impact measurement at the core of our investment decision process. So really keen about evidence, about research, about that connection from research to operational feasibility, to market, and to scaling. And on that scale, you know, commercial scaling, but for us, because we are an impact fast fund, and because I come from the public sector team, we think about public sector pathways to scale. So how can this be scaled and supported by government agencies, multilateral agencies, such that they're sustainable and do not require infinite philanthropic support? And then maybe the last thing to mention is, you know, we fund across the whole range from pilot or proof of concept all the way to plausible scale pathway, with a focus on the need to build more evidence on the impact or operational models. I see innovation funding specifically as the process of buying important answers to important questions. So if you have questions you need to answer, you need to figure out, then I think GIF particularly and funders like us would be the best fit for you, and thereby de-risking an innovation for hopefully catalyzing subsequent investment and of course scale and sustainability. Thank you.
Thanks, Teresa, and I'll come back to you. There's a couple of things I want to just unpack from that intro that you just made. Let me move to Simon, who's a long-time friend. We've engaged for many years, I think, on different projects. And I was really happy to find that he's now on this innovation side. I left him on the health side. Now he's on the innovation side. Not that they're very different, because I think even on the health side, you're still funding innovation. But I guess now you're a bit more generic from that perspective. But Simon, over to you for introduction.
Oh, thank you, Steve. And thank you to the Victoria team for arranging for this. Very excited to be around and to be around innovators and the people who are making it happen within this space. My name is Simon Doria, and trained as a banker. And I actually did banking for around 8 years, but I was working with the SMEs. And I found myself working with SMEs, crossing over to the doing a bit of science, because I did a bit of water funding, WASH funding, and also healthcare funding. And later on, I came to join in the development sector. So that's where we met with Steve when I was doing health innovation financing. And for the last around 7 years, I've been working with innovation in science. And currently, I'm with Science for Africa Foundation, based in Nairobi, Westlands. And Science for Africa Foundation is a Pan-African organization, a public charity. And we support scientists in the African continent. So our work is quite diverse, starting from enabling our research, enabling careers for scientists, and as well, when it comes to innovations that comes out of the work that they are doing, we want to support the innovation to get into the market. So this is a very right platform for us, just to see how we can support the innovations to come from the lab and go to the market. And we work in 3 areas. We work in health, agriculture, and climate. We also fund across 3 stages. We do, and we are quite distinct in our funding. We do seed funding, then we do transition to scale funding, and we do scaling. And all of it is grant funding. We are not using different instruments. It's strictly grant funding. The program I'm with, which is pushing this, is Grand Challenges Africa. Grand Challenges Africa is the program that drives innovation and entrepreneurship of science within Science for Africa Foundation. GC Africa is a member of a wider Grand Challenges family. A few of you may have heard about Grand Challenges, India, Canada, South Africa. We are a family of around 15 Grand Challenges spread globally. And we work together. Right now, as we speak, we are in a annual general meeting for the Grand Challenges, just looking at how we can connect, how we can collaborate to support scientists across geographies to do their work much better. So thank you very much.
Merci beaucoup. Simon
Oui,
is
monsieur.
in Senegal at the moment, so I think his French must be getting better. Okay, cool. So let's then just jump in and we'll peel the onion bit by bit. So Teresa, let's start with you. And I think you've spoken about a number of things in your introduction. And let me just speak on the first one that I thought is interesting just to start from. That you have a rolling sort of like application. So if anyone wants to talk to you, they can talk to you at any sort of like one point. You fund all the way from pilot sort of like to later stages. So I guess one for me is, what do you look for in an innovation that comes to you? When you're sort of like saying, okay, this is interesting, let's recommend these. What do you look for? And maybe if you'd like, you can pick out an innovation that maybe you guys are working on currently, or that you've financed within the continent, and just use that as an example in terms of how you would evaluate a specific innovation that comes your way to figure out whether you should be financing it.
Thank you. I think that's a very excellent question, and it's always the first place that innovators should start with, what different funders look for. And for us at GIF, it's in our name, and what I said in terms of our mandate. The first thing is always that innovation. So we look at how is this solution differentiated than standard practice. And two things we look at there is, first of all, the problem and context. And then we also look at the solution itself. So, we try and understand what is the problem that you're seeking to address, what is the context of that problem? Why is it a problem? And it's also an important consideration in the development space. Where does this problem stand in the overall development landscape? And I'll give you an example before I go to my specific example of if you're growing cashew nuts versus if you're growing maize. Why should one be more important? Why should I invest in cashew nuts rather than investing in maize? Is there a climate adaptation angle? Is there a resilience angle to one of these products that you're offering? So that's usually the most important thing to think about, especially for funders like us. And then secondly, it's looking at that solution that you've proposed. So how is it innovative? How is it different? And then I talked about scalability. Is this something that could be scaled? Because we don't want to invest in something that can only reach 200 people, and that's the maximum impact that it would have. And then also looking at what is the competitive alternative solutions? How does it differentiate one clean cooking stove solution to the other clean cooking stove solution? Why is yours better? Is it more cost effective? Is it the product that you use to develop that solution? Is it how you get it ready for market? Is it who you market it to? Is it who the workforce that you have behind it? So who's selling it? How are they selling it? So really thinking around what makes you competitive against all the alternate solutions, because a lot of those ideas, we've seen one variation or another, but we want to bet on the winner. So how are you differentiated? And then of course, given that we have that focus on evidence on impact, what's the theory of change for the proposed solution? So that's usually really key for us. And then the second thing is measuring success. Examining what's the evidence you have. So, theory of change, conceptual basis for the theory of change for scientists specifically. What are the channels of impact for this? And I'll give an example of, if your solution has maybe a mass media channel and it has a training or capacity building channel, how do we know? What evidence do we have? Even from research, you don't have to be backed up by having already operated this. Even from research, how are these channels more impactful than the others? How can we measure the impact of these channels? And then the third thing we look at very specifically is the team. And here, because I'm speaking to researchers, one of the things we look at for us is because we really don't fund that lab and testing phase of the innovation or the solutions, we try and see what key skills or capabilities or even commitment do you have to take this solution to market and to also scale it? How do you understand the problem? How do you understand the context, not only from a research perspective, but also from a real world application perspective? So, showing very strong potential to drive that innovation via your own ventures, your own partnerships, or even some of the partners and people that you are working with. And I'll just use an example to illustrate these different areas that I've spoken about. So we recently invested in a solution called Vandevereho. Vandevereho is Kinyarwanda for role model. So it's Kinyarwanda for role model, and it's run by an organization called Rwanda Men's Resource Center, who'd been working in the men engagement space for a long time. And then they partnered up with a research institution called Equimondo, based out of Brazil, to try and now start testing out the impacts and the outcome of their solution. And one of the development problems here is that in the Rwandan context specifically, there is a very strong political, legal, and even policy commitment to gender equality, but gender gaps still persist. And so we think of men as one of the gatekeepers for all the norms, as well as allies and co-beneficiaries for gender equality, but some of these interventions are always interlooked. And so RAMREC has this solution where they're trying to transform gender norms by using fatherhood as an entry point to engage men and their female partners in maternal, newborn health, violence prevention, or unpaid care work. And they have a participatory model for this solution via structured sessions and via community role models who deliver it. And in terms of thinking about the evidence, for a long time, they just worked being able to measure, continuous monitoring data on some of the impacts of their own solution. But then once they partnered with this research institution, they were able to do an RCT that showed significant impacts. They were able to test this specific solution from one of the partners that Simon has talked about, Grand Challenges Canada, who helped them start that phase of testing it. And by the time they came for us, they were in that space of trying to refine this and trying to test various scaling pathways. So they had partnerships with government. They really haven't scaled completely, but they have this interest from government, specifically from the Ministry of Health, that said, all right, this solution could potentially be tested through community health workers. So why don't we start a trial integration phase? And so you need a funder to come in and de-risk, because you don't know if this is going to be successful or not. And so we were able to come in and provide that anchor funding for them to think about how can we take this specific solution that has now been tested, really operationalized in one context, to think about how can it be integrated with government. So innovation, solution, what's the problem, what's the solution, what's the context, how are you going to measure success, what's the team, and if the team doesn't have the scaling capabilities, do they have interests from potential partners, do they have the correct ventures or partnerships to start thinking about as they take that solution to scale.
Thanks, Teresa, and thanks also for that example. Maybe let me ask just two very quick follow-up questions. Because you mentioned innovation, and I guess from a researcher's perspective, there's a question of how do you test innovation? Is it that I have a patent? Is it that I have a trademark? Is it that I have a copyright? What's your test for the innovation bit? And then just out of curiosity, you would be able to do grants all the way to equity and so forth, or do you sort of focus on specific bits?
So I find that very question on patenting very interesting, because it's on a case-to-case basis. Because our definition of innovation is very broad, so it really depends. For instance, let's say in this specific case that I've given about a curriculum, there is an opportunity maybe to patent that curriculum. There might be something around it or have some copyright licensing around it. So it's really on a case-to-case basis, depending on the product. Maybe one of the things that GIF can help you with is actually to form the right partnerships for you to get those patents. It's a long process. You probably require certain funding for you to be able to go through processes to get the correct patenting. So it's really on a case-to-case basis, but also because, we're thinking about scaling through public sector pathways. For us, open sourcing it, cost effectiveness is also a really big consideration. So no straight answer, but really on a case-to-case basis, because if this is integral to your model, then there is a case to be made on having that patent or having the right copyright licenses for your solution. In terms of debt versus equity, I think GIF is very interesting because it's an intermediary funder that can take those risks across the different instruments. So it's usually about that impact first lens, and then, what type of capital you need. Most times, often always comes from the innovators themselves. And as we go through the diligence process, probably you wanted an equity structure, but as we go understand the solution you've provided, where you are at, what opportunities lay for GIF to actually come in and be additional. We can say we think maybe testing out the gender angle requires probably a grant funding and would be willing to take that risk to help you test out some of these things. So it's really dependent on the need. And as we go through the diligence process, I know some funders talk about co-creation processes, co-design processes, on market feasibility of some of these solutions. And I think that's where some of those conversations come from funders that have that leeway to actually test the different instruments.
Thank you very much, and thanks for that definition. But innovation is not necessarily that you have IP registered. It could also just be in terms of the business model, what you're sort of like how you're approaching things. I've seen that Sonia, who's our meals, Dan is not here, but I think we'll speak about impact and Jesse, because I'd like to hear just your thoughts around Jesse and how you evaluate that and just get your sense from that for the innovators. But let's come back to Simon. Simon, I guess same question. One is, what do you look for when you're looking to, make a grant to an innovator? And maybe you could use a case study here and say, for instance, one of the items that you guys financed and how you took it through that process of the evaluation, so that we get a good sense of that. And I think I've seen, Odak has asked a question. He said, could you please share your contacts in the chat? I'm just going to ask you now, while you're speaking, if you don't mind, maybe Teresa, you can add your LinkedIn or your email, and then people can know how to be able to get access to you after this conversation, just in case they're interested to reach out to you. Simon, back to you.
Oh, thank you. I feel that we are more like aligned with what Teresa or GIF is looking at, and being more or less in the same space. So I'll say emphasize or highlight more on the areas that we are heavier on, because things like scaling, the scalability of an innovation is very important for us. The team, the innovation itself is so important, the technical bit about the innovation. But for us, being a science funding institution, and our innovations are mostly coming from, let's say, deep science or the labs, we are quite, the first and most important thing to us is about technical soundness or the scientific soundness of an innovation. And here, we'll be looking at the evidence that has, the scientific evidence that has been generated, maybe in form of publication, in forms of other reviewed literature regarding the innovation. And we are also looking at the capability of the model or the innovation to work across, say, diverse social contexts. And sometimes you're also looking at, is it supported, say, by eminent institutions? Where is the research coming out of? Who are the collaborators? Do you have like eminent collaborators? Although not so heavy on this, but it's an add if it has very strong evidence that it's technically sound. And in most cases here, we'll apply peer review at this point, so that when an innovation, if, for example, we are talking about an innovation in drug discovery, we'll bring in drug discovery experts to come and evaluate and give their independent evaluation. So that's very important for us, looking at our focus. Then as far as the innovation is concerned, these are matters to do with relevance, and that one I'll just add top of what Teresa has talked about. And here we are looking at a policy agenda. Where is your innovation, or is the innovation on top or somewhere in the policy agenda? For example, if you look at Africa, we are looking at the SDGs, we are looking at STISA. If we go down again to the country, we are looking at R&D priorities in a country. So it stands a better chance if it's, say, addressing R&D priorities with and sorry, we are just sometimes used to so much of the short forms, research and development agenda within a country. So if it is fitted within that, fitted within the STISA agenda, the AU STISA agenda, and again, the SDGs, then it stands a bigger chance. Of course, looking at relevant or relative advantage, or the same as Teresa has mentioned about the competitive edge. Scalability is also very important for us. Impact also, and here in as far as impact is concerned, we are considering is the impact visible to casual observation, or is it tangible? And number two, the association of the impact with the intervention. Therefore, working with sometimes very early stage or lab, people who are just working to prove concept, it's more of the projected impact. Are you able to articulate the projected impact in this case? So basically, that's what we are looking at. And I'll say, again, since we are in the seed stage, transition to scale and to scaling, the criteria varies as we move across. So for the very early stage or the seed stage, we are so heavy on the scientific excellence. So the weighting is heavy there. Then when we come to transition to scale, and transition to scale will start after proof of concept, we'll still consider scientific excellence, but now we'll be adding some more weight into matters of sustainability. We'll be adding more weight on scalability of the innovation. And as we go towards scaling, now the aspect of sustainability comes like on top. Like, is it cost effective? Does it have its own or internal revenue generating models embedded within it? Therefore, we'll just keep on changing the weight as we move across the various categories of innovation. We work with both the private sector scaling, that's more of commercialization, and we also do public sector scaling. Thank you, and over to you, Steve.
Okay, thank you very much. Maybe just to double down, so do you work on a rolling basis also, or you have specific calls that people then apply for? And what kind of amounts would you then disburse in the different the different phases that you've just mentioned in this case?
Well, I'll just highlight a bit about the process we undertake to just to the point of funding. For us, number one, we start from quite early, and we do a bit of priority setting. Therefore, for example, if we are looking at maternal, mother and child health, we'll first want to understand, and our focus is actually the continent. We'll want to understand from scientists, top scientists within the continent, what are the top problems, or what are the top research priorities within the continent. So we do convening, and then they rank the needs. So once we pick, say, the top need, then we'll do a request for proposals. So ours is not rolling basis. We do specific RFPs. So we'll say MNCH, call, maybe childcare, maybe hospital management or digital tools for MNCH. So it's very specific. Then we open a call for, say, we normally do 6 weeks, 6 to 8 weeks. And these calls are very openly advertised. And we spread it as wide as possible to reach as many throughout the continent. Once we have the applications. We will do the reviews. Of course, we start with the peer reviews. That is scientists coming on board, mostly for the seed. Then if it's a transition to scale, we'll bring in also experts in finance, experts in business, who look at the business case. And after the reviews, we go to due diligence. Due diligence comes together with negotiation. So here we are looking at your budgets and also your resource management framework. And after this comes funding. For our seed grants, we do up to 100,000 USD. Sometimes in some areas we'll do a little bit more, and up to 200,000, and the period is usually 1 up to 3 years. For example, in fields like agriculture, we find it's a little bit easier sometimes, depending on the projects, to prove concept within a year. In other more niche areas, for example, in drug discovery, they'll need up to 3 years to prove concept. So we'll do up to 200,000. But for transition to scale, we do up to 1 M USD. And this is a purely grant as well. For scaling, we'll do up to 1.5, but here we are at a point that we want to win off. We are imagining you've been grant funding at seed grant, transition to scale. Now you should be getting out to the market. Therefore, here we want to, we are working with the smart partners, people who can put in equity, and our work is more like to de-risk the investment. We put in the grant bit, then a partner will come in and put equity, and we are able now to take you off the grant cycle. Because what you've noted is probably with reliance on grants, the aspect of sustainability is suppressed. So we want to, as you move along, move you over to even commercial funding.
Okay.
Thank you.
Thank you very much. Wow, I feel like we're running out of time and we just started. Teresa, short answers now, almost like 3 bullet answers. So one for you is, what's your typical investment process? And you're speaking about that. Maybe just speak to us a bit about due diligence. You know, or what does due diligence look like from your side? And what would you advise innovators generally from a due diligence? What do they need to start doing as early as possible?
That's a very good question, because it ties into when Simon spoke and I spoke about, he's talked about proof of concept and I've spoken about proof of concept. And maybe just a differentiation is our proof of concept, or what we call pilot, starts at about 200,000. And our test to transition starts at about almost 1 million to about 2.3. And our scale is up to about 15 million USD. So one of the important things I think innovators in this school need to understand, and that's why we usually advise you do your own research and even look at previous innovations that funders are funded, because we might say proof of concept, but we have different bars or criteria or how we look at proof of concept. Where at GIF, we really don't fund the lab testing and the very early stage ideation process. But after you have the idea and you've just started the very early stage market operationalization, then GIF becomes that intermediary funder, maybe between Science for Africa and the next funder who can take this way beyond the $15 million mark. Maybe the USA do now want to incorporate it into government policy, or the World Banks, which we've done with previous investments. So those are some of the distinctions I hope that innovators start picking on this school. And that's why it's very important to actually do your research and understand, even as we say, proof of concept, it's not synonymous across the different funders. And that also speaks a little bit to the diligence process. If you understand, it's really, really key to do your research. Speak to people who've been funded before, stay on the websites, look at the organizations they funded before and what they call the development problem, what they call, the investment opportunity, for you to start understanding what would be required for diligence. For example, Simon talked about for them requiring experts to come in. And for us, we also have that development lens. And I said the first critical thing we look at is the solution, is the innovation, the problem and the solution. So we spend a lot of time understanding that problem, understanding the solution, talking to a lot of maybe experts, your partners and other people to really get a sense of this innovation that you are proposing. So diligence looks different for different funders. For them, that diligence process is bringing in the experts. For us, it's really spending a lot of time with you to understand your organization, your solution, you as a person, your own motivation, your own capability, before we even dive into things like budgets. Because if the organization and the person has a good track record, then the budgets, it's more or less a negotiation and just sort of verification steps. So understand what's core to that funder, and then that is really what will inform the diligence process. So for us, the diligence process is anywhere around 4 to 6 months, starts with really unpacking that problem, that solution, speaking to different partners, then taking it to our various investment committees. Part of our diligence process is also trying to understand how you address things like environmental, social governance responsibility. That's key for us. Gender is key for us. We do have gender specific deals, but across all the innovations, we try and find out what's the gender aspect, what's the climate aspect. So those are really core for us before we dive into things like, the budgets and the grant agreements and the period. And for us, we also fund anywhere between 3 years, but really could provide upfront funding if that's the need, and then do maybe a long-term, about 3-year grant for you to actually implement and prove out this concept. I feel like there's a second part of this question that I might not have answered, but yeah, I can come back to it later.
Yes, I mean, I think you've addressed it, because it was just your expectation from how long the process takes. And I guess the part that you didn't speak about is just generally from a DD perspective, what would be your advice for innovators in terms of what they need to be doing on a day-to-day basis, just preparing for that?
And I think it also just speaks to what I've pointed out in terms of understanding, just doing your research on the funder that you were specifically looking at, understanding their processes and understanding how they do their own funding. I think this is really, really key for innovators. Understand the type of funder, do your research, speak to them. And then there's the second thing where, unfortunately, this is some of the jargon around the spaces we are in, priorities versus criteria. So spend a lot of time understanding the criteria. When I talk about, impacts and measurements and outcomes, do you really understand what that means? Can you look at some of the things that we funded to try and nail that down? If you're looking at, things like scale, the way I speak about scale is very different from how other funders speak about scale. Because for me, when it says a policy window, we also want to tap into that policy window and see, is there an opportunity for this innovator or this solution to actually actualize? Can you go to government and say, all right, you've put in, I don't know, child protection policy. We've been working in child protection. We know how to engage with communities. We know how to do this. Can we come in and help you? We've put in early warning systems. Government has this policy on early warning systems. You have a solution on early warning. Can you come in and say, this is the policy, this is the opportunity, this is the scale pathway, and this is how we're going to come in. So understanding the funder, understanding the criteria, I think is very key. And then after that, the whole process falls into it, because then you're able to identify where are my gaps, where are my opportunities, and how can a funder come in. So that would be really my advice to innovators or anyone who's seeking to actually pursue a different opportunity from different funders.
Thanks for that, Teresa. And Simon, I'll come back to you. We seem to have lost your video. I don't know whether there's a problem there, but I just asked a question. I hope you can hear me. So again, the same question, maybe a bit summary. I see we have now 9 minutes, because I want to finish at the top of the hour. So for you, how does due diligence look like when you're sort of like then granting the funding? Assuming you've gone through the criteria, someone has been selected, and now you're saying, let's move to the DD phase. What should innovators be thinking about preparing themselves for you when you're coming in to do your DD? You're on mute, sorry, Simon, you're on mute.
Yeah, first of all, a note and a follow-up to what Teresa has said. Maybe our terminologies vary a bit, because you'll find that to some of the development funders, diligence is more like review. So they are looking at also the technical perspectives and the innovation perspectives in what they call diligence. For us, what we call diligence is after we have approved, you have been ranked, or you're fundable, then that's the time we get to diligence. So diligence, due diligence for us is just getting, number one, to check into the PI, your capability to administer this grant. And we'll be looking at you as a person. We'll be doing background checks. It's important then here just to be sure you are in the right books. And also something important we note is in this grant funding world, there's quite a lot of interconnectedness. Found cases where due to lack of, or say some form of blacklisting in within the funding sector, the grant funding sector, PIs or principal investigators have been denied grants. So there's always background checks, personal background checks. One.
Yeah.
Then we come to the institution. Is your institution able to administer the grant? So here we'll be checking into the governance. How is the institution governed? We are looking at financial management in terms of budgeting, financial reporting. We'll be looking into things like procurement. Do you have policies? Do you have procedures? Do you have planning? We'll be looking into things even like human resources. Do you have HR policies for managing your people? Therefore, we need to, an institution needs to have the right policies, procedures in place, systems in place that convince us that you are able to administer the grant. And again, we are dealing with both larger institutions. For example, we may be working with somebody from Cambridge. So here we are looking at yourself as a PI and the institution itself. But again, we work with smaller organizations, mostly when we come to transition to scale, because you may have spin-off, may have had a startup. So it's also, we get a little bit lenient as far as startups are concerned, but you may not have policies in place, but you probably need to have guidelines in place to be aware that this needs to be known. You may not have a full board in place, but we may be looking at, do you have the right team? Do you have the right advisors? Do you have the idea? Are you working on it? And we not only check this from a perspective of whether to give or not, but also from a perspective of where do we support? Because, for example, for now the very young startups, you may find so many gaps as far as the institution is concerned, but we'll want to put these as points of support to you, so that as you build the innovation, you're also building the institution, you're building your startup in terms of governance and readiness to administer the grant.
Yeah.
Thank you.
Okay. Thanks. And I like that point of looking to support, not just saying because of this we will not give you the funding, and working together from our perspective. Let me come to you, Teresa, and I'm going to ask two questions in success. And thank you so much for answering the question that was there on the chat from Odak. So Teresa, how important are JESI considerations for you outside of impact? Because you have all the other impact metrics that you spoke about, JESI considerations. JESI is gender equality and social inclusion.
I think for us, it's really, really important. I think, first of all, we started from the lens of, being sector agnostic, but increasingly from our own work, I am, working in the development space, wanting to reach the people living below the poverty line, the marginalized people, then such considerations become very, very critical. So at GIF, we even have gender marker that we apply across all our investments, and I can share that with you for you to share with the team. So just applying that lens across all the innovations that we work with. And for here, you really don't have to maybe, be gender transformative, but it's an element of just seeing to what extent have you considered gender dynamics and what's the opportunity for you to strengthen this. So very important, if it's a gender deal, then the bar becomes very high to think about, is it completely inclusive, or, you know, what are the missing proof points? How inclusive is it? Is it really addressing the gender dynamics for that solution itself? So to just summarize, very important. And to also say climate is now becoming a big one, that we are also thinking about how do we apply a climate lens across all investments, because as we think about adaptation and resilience, even strengthening someone's own development, social impact outcomes does strengthen their resilience. So it's also becoming an increasingly important consideration across all investments.
Okay, I mean, we'd be very happy to get the gender marker, and you can share it with the people who sort of like attended the webinar, for them just to familiarize themselves. And for you, Simon, same question. How important are GESI considerations when you're choosing to fund a specific researcher or innovation in this case?
As well, very important for us, and we are quite, say, intentional in bringing this context into our evaluation and portfolio. So at portfolio level, we'll want to balance, because for us, at least, we do it on a cohort basis. Therefore, at the end of the day, innovations which are fundable will still balance, so that at least the focus on low and middle income countries. So if we are finding that most are coming from higher income countries or upper middle countries within the continent, we want to balance at the end of it, so that the portfolio is reflective of and representing areas which have been kind of excluded. Yeah. And then we come down to the innovation level, that in evaluating an individual innovation, we will want to look at who are the beneficiaries. Okay. Are you able to target those who have been excluded? Are you able to target women? Are you able to look at communities which are facing some form of social exclusion? And that one is embedded into our selection criteria very strongly. So at the end of the day, we want to have a portfolio that is representative, and as well individual innovations that are addressing GESI issues.
Okay, thank you very much for that. And it's important that innovators realize that these are key considerations that they need to be having. And during our training, we really emphasize this. Now, we do need to finish. We have 2 minutes. So I'm going to give each of you 45 seconds, and then I'll take the last, I don't know how many seconds that is, 30 seconds. But I want you to ask this question. Of course, you've shared your contacts so people can be able to reach out to you. We know your website, etc. So thank you very much for doing that. And also thank you for joining us. But could you, maybe Teresa, starting with you, any success stories, your closing remarks, maybe just one statement that you think is very important, just to emphasize. I know we had so much we wanted to cover. I think we were overly ambitious. And then just, any success stories that you've had that you'd like just to point out, where you've worked with researchers or with the innovators, just to create a bit of context as you close your remarks. So to you, and then after that, we move straight to Simon.
I think I'll just mention the example I gave before, Vanderbereho, because for me, it's usually a very good example of a local organization that didn't start out being centered in research, but over time, strongly started thinking about research, rig of evidence, working with a global North institution. And for us at GIF, it was one of those things of how do we then help this organization become stronger in their own research, and how do we help both organizations in that transfer of skills and really collaboration in the work that they are doing. You can read more about it on the website. I'll also share it, but really interesting test case. I think for products specifically, there are quite a number of examples, from Smart Start in South Africa to Health Connect to there's one called Place right now. It's a pilot stage on remote, I think it's remote sensory satellite. So really good examples on our website of various things, from products to services to even how people think about policy, with the evidence really being centered and a scale mindset.
Okay, thank you very much, Teresa, and thank you for joining us and for that example. Simon, to you, parting shot, and one success story that you'd like to point out just for us to reflect on.
Well, very many success stories that we can share, and the highlight I would just like to give is about collaboration. Speaking the word from Teresa, that in this space we work a lot in collaboration, and our success cases will be owned by many mothers or many fathers. So, but success to us means maybe a project starting from seed grant and going all the way to scale. And for example, one of them is a diagnostic device that was developed in Ghana. Started research, a PhD student working on the device, completing his PhD proving concept, and after that going to clinical trials, the product being licensed within the country, and starting a manufacturing facility for that, and getting to the field. And as from his report last month, he had done over 50,000 tests, and the disease is yours, a disease of poverty, very much in the rural areas, secluded communities, which did not have this diagnostic in place. And what it meant is that a test for this disease would take like 1 month for you to be diagnosed, and most children. But now he's able to go into the field. It's a point of care test kids, provide fortunately the medication. Once you're proven to have this disease, then medication is so easy. So we are happy, at least one, he's moved across the stages up to now scaling the innovation. Number two, the success for us is about building local capacity, which is in line with Science for Africa, what we do. So we've built local capacity for manufacturing for this specific innovator. And when COVID came, due to this local capacity, he was among the first people to produce the COVID test in Africa, due to the capacity, the lab capacity that we are able to do using this grant. So for us, it's more about also.
Simon, everybody is just saying, why can't you tell us who it is? All of us are saying, who is this?
It's called in-cast diagnostics. You can yeah, I'm happy to say. It's in-cast diagnostics. You can see, you can even see in the news where they featured. It's in Ghana.
Yeah.
So happy and proud of amazing, so many amazing. And other collaborators who can also claim success. GC Canada, we have co-invested, and GIF, you're welcome to co-invest there moving forward. Thank you.
As Victoria will be charging us a success fee if GIF invests in that, because we are facilitated. But thank you very much. Really appreciate your time, Simon and Teresa. And amazing to hear some of those stories that you've just spoken about. Thank you so much for sharing your contacts. I think we will be in touch. If someone is interested, can reach out directly, can reach out to us. To the participants, this is just a taste of what you've been doing with these webinars. We have one more webinar coming at the end of the, I think, next month. Follow us on our socials. You'll be able to pick that up. We've had webinars across different topics from the beginning of the year, 11 webinars in total, including this. So feel free to go to our YouTube page and you're able to access these, and you can get to learn much more in terms of this innovation space. And if you want to meet some interesting people, we have lots of contacts that have come through for these conversations. But from me, it's to say thank you very much. We've gone over time by 5 minutes, but I think it's been worth it because the speakers have been amazing. Thank you very much, and do have a lovely rest of the day to you. We'll close at this point.
Thank you and good afternoon.
Thank you. Goodbye.